All right, welcome to the Experience Better video podcast series. I'm Josh Beekler.
I'm Adam Leese.
Today we're going to do some dry needling on me.
Yep.
Low back, guinea pig. So, a couple weeks ago, I bought some IKEA furniture, all that hand tightening with that little Allen wrench, tweaked my back.
It's not here. You don't have.
No, actually, I was doing some manual outdoor labor, some manly things, but I was using poor body mechanics with lifting a couple times, and I've had a back injury in the past, and I irritated it. So I knew that Adam would help me out and fix me up, and so he's going to dry needle my low back, and then I'll post in the comments in a few days, let everybody know how I'm doing. So
awesome.
You ready for me to hop up here?
Yep. So I'll let you go ahead and lay up here on your stomach. All right. And so what we would do if you were a patient who was coming here for treatment, we would obviously do a consent form. We'd do a thorough evaluation. We wouldn't just pop up, hey, yeah, your back hurts, let's do some dry needling. So Josh is a physical therapist, so he knows what to expect, kind of knows what dry needling is. Josh also does dry needling, so he's done this to multiple people. And so we go through evaluation. We make sure that it's an appropriate tool for the patient. And so what we do is, assuming that everything looked good, and I've talked with Josh, and I know what's going on, where he's having more peripheral type pain, so it's not necessarily along the spine. He's not having any pain shooting or radiating down into his legs, and it's more muscular in nature. So what we're going to do is we're going to needle the L4 and L5 spinous process. And so if you don't like needles, or you're not a fan of anything like that, you might not want to watch, you can just listen. I'll kind of explain what's going on. We're not trying to do anything that will make anyone squeamish or not enjoy this. So what I did is I wiped the area of his spine that we're going to do with an alcohol prep wipe. It just tries to decrease the risk of infection. The needles are obviously sterile, but the environment is not sterile. And so since we're not in a surgical suite, there's nothing that we can do. Josh has been cued. He kind of knows what to expect, but usually it's kind of a little bit of a poke as the needle enters the skin. The needle is very small, and this is just a guide wire. You can't even see the needle here. But what we do is we find the spinous process here. So this is Josh's L5 spinous process, and we go about 1/4 to a 1/2 inch off to the side, and I let him know, Josh, you're going to feel a little bit of a tap here. And so that's usually the worst part. So now the needle's poked through the skin, and now what he's going to experience is a dull, crampy, achy type of sensation. What's not normal is a sharp pain, any numbness, tingling, any weird zinging feeling down the leg. That's the stuff that we're trying to avoid. And so we just put the needle in until we hit the spinous process. You doing all right here, Josh?
Yep.
So.
Dull, crampy, achy.
Yeah, dull, crampy, achy sensation. And so that's the one side. For the purpose of the video, we would normally switch sides, but just for me being in the way, I'm not going to do that. And so we're just going to go here. And so it'll be a little bit different. Same thing, Josh, let me know if you have any weird, funky feelings. Dull, crampy, achy is normal. All right. And so as you can see, some of the needles sticking out. Everyone is a little bit different as far as the amount of adipose tissue, the amount of muscle tissue that you have to go through. What we're actually doing is we're going down to the bone. And so this is actually touching his spine. It'd be the body of what's called the lamina is where we're going to, and that's our back landmark. And so what it does is it goes through all of the paraspinal muscles. There's some that run just from one segment to the other. There's some that run like 2 to 3 segments, some that run like 3 to 7. And so they originate down here, and they might insert all the way up here. But we poke through all of those. So if you extend your back or arch your back and you feel on your back, those muscles that pop out next to your spine, those are the muscles that we're trying to get here. And so as the needles are in here, you can just let them sit there. Some people, they just have an increased amount of tone, and so they do this. You just let the needle sit there for 5 to up to 10 minutes. But what we're going to do to help speed the process up is just use a pointer and a little E-stim here. So what we're trying to do is generate a little bit of a muscle contraction, not something that you'll be able to see at home. But I just give Josh the cue. Josh, I want you to go ahead and let me know when you first start to feel anything. And so we're just turning this pointer up here to the point where Josh feels something. So he's feeling it there. Now I would cue him, hey, I want it to be a comfortable sensation, just like a little bit of a rhythmic contraction.
Back off just a little bit.
A little too much.
There you go.
There we go. So then we hold this here for about 30 to 45 seconds. And so I'll just kind of talk to you here. So dry needling, as we've talked about in previous episodes, it's a tool for really any muscle condition. It's not going to correct anything as far as like a broken bone or a torn meniscus or anything like that. But it is pretty effective for musculoskeletal pain if it's originating in the muscle itself. So what this is doing here is we go through, we poke the muscle, and it releases some of its cell contents that are causing it to spasm or causing it to have increased tone out into the space surrounding the cell. And so what that does is it helps promote relaxation. It can help facilitate healing. Typically, we see a reduction in pain. If we were doing a thorough evaluation, we would do range of motion values. And so we would be able to see that Josh had increased range of motion of 15 degrees flexion and 10 degrees of extension, or he had less pain at the end ranges. And so take the needles out here and just doing some massage just to try to decrease any soreness. If you just take the needles out and leave them on the table, then they usually the patient might have a little bit of soreness afterwards. It's not it can be uncomfortable at times. Most 95% of people don't have any increased pain afterwards, but every now and then you do have someone who has increased pain. And then so I would tell Josh here, hey, I want you to drink an extra glass of water, so about an extra 8 ounces of fluid than you normally would. And then what that does is that just helps with a reuptake of all those chemicals or any of the neurotransmitters that release out into the space surrounding the cell, just help decrease soreness. So.
It's kind of the equivalent of getting like a deep tissue massage, the same
Yep.
kind of idea, releasing a lot of those neurotransmitters that are associated with pain and dysfunction in the muscle.
Yep. And so then that's the treatment. So what we would do is we'd have Josh get off the table. We would make sure whatever functional thing that he was having difficulty with, whether that's bending down to touch his toes, whether that's lifting, whether that's just assessing range of motion, that's what we would retest again after the treatment.
Very good. Well, thank you very much, Adam.
Yeah,
appreciate your help, and we'll see you next time.
Yep. Thank you.